When patients come to see me for hair loss, what I try to explain to them is there are a multitude of reasons in why people lose their hair. It's not always female pattern hair loss, and I think that's what scares most women when they start shedding. But there's a number of reasons, and there are a number of causes. But the thing is that most of these come about 3 months prior to the person coming into the dermatologist's office. That's one thing I do want to specifically point out, in that people think it was something they did the weekend before, or because they just got their hair colored or chemically processed, that's what's happening. So when we look at hair loss, we look at, are you losing it from the root, or is it breaking? Is there fractured hairs? And then we determine which one it is, and then we go from there. If it is a hair loss situation, we try to determine, well, is it a scarring type of hair loss situation or a non-scarring type of hair loss situation? So when patients come in and say, I have alopecia, or I was told I had alopecia, well, alopecia, all that means is it just means hair loss. So it's very important to get a diagnosis of what type of alopecia that you have. And therefore, that's where the dermatologist comes in. Sometimes it requires blood work. Sometimes it requires a scalp biopsy to determine what's going on at the follicular or root level. Occasionally, we will just see infections of the scalp, like a fungus infection or a folliculitis or bacterial infection that's causing you to shed your hair. So it's very, very important to consult with a dermatologist when you have hair loss. Then we can take it from there and do a workup. I know in my baseline workup, I'm looking at hormones, I'm looking at your thyroid. I'm also examining the hair under the microscope to see, am I dealing with just breakage, because you wear your hair bleach blonde, and that really strips the keratin, or strips the protein of the hair. Unfortunately, dermatologists are trained in skin, hair, and nails, but there are not a lot around who specifically train and do further training and specialize in hair loss. So even with dermatologists, you do want to choose someone who's accustomed to dealing with that on a daily basis.